Thank you, Gubella Freeber. Thank you to WHO for this invitation. And in speaking about SDGs, I'm also going to give a bit of an overview of some of the research challenges, and I think particularly within our field, the issue around systems thinking, because very often we hear the term systems thinking, but people aren't always clear what it is. So I'm going to try and make a case for why that's important for us to look at. So the WHO Action Plan, which many of you will be familiar with, stresses three things which I think are particularly relevant to why we're here. One is the importance of removing barriers to access. The second one is very explicitly relating to assistive technologies. And the third one is about the value of having comparable data. And I suppose that's both across countries and across different sorts of technologies. You've already seen one of the disadvantages of coming later is people have used some of the slides you were going to use as well. So I'll skip over some of these rather quickly. But the strategy of GATE, as you've heard already, is looking at policy, products, personnel, and provision. And I think from the Sustainable Development Goals perspective, one of the really exciting and different things about GATE is that we're seeing GATE in the realms of population science, not just population health, because GATE is much broader than just health. And so it's moving it beyond rehab. Rehab is obviously still a crucial part of it, but it's trying to make it much more part of everyday life for a large number of people. So it's going to become more familiar, less sort of silo-ized, if you like. And it's also going to become much more cross-sectoral. So in terms of systems thinking, I'll return to that in a bit, but I just wanted to pick up on what Saeed was saying earlier in terms of really technology being transformational, that we often, I think, tend to think of technology as being incremental. It can slightly increase or improve the way we do things, but I think there were some very nice examples of how technology actually transforms how systems can work. I'm part of another network to do with remote healthcare, and I was at a presentation recently there looking at an anaesthetist who works in 4 different hospitals at once, and they are all relaying information to the anaesthetist, and the anaesthetist is deciding on dosage levels and so on. Something that wouldn't have been possible before. That person's expertise is available not just in 4 different hospitals at once, but in more than one country at once. So technology is really changing what is possible. And we are interested in developing a new global research infrastructure. And I think here one of the exciting things is that sure there are gaps in what we can provide in assistive technology research and expertise, but those gaps can actually become our strength by bringing together groups with different sorts of specialties. So we have the 50 assistive products that you've already heard about, and we have the 5 priority areas. And I think 2 things that are important in terms of the process that was gone through in developing those 5 priority areas are 2 overarching themes. One is to do with the user involvement in all aspects, and another one is a very explicit buying into the social and environmental model. So we're certainly keeping within the frame the importance of fitting the technology to the person, but we're placing that in a much broader context. The Assistive Technology for All event at the World Health Assembly was a major milestone, and another one that we hope will also be a major milestone is the Great Summit. You can see we're very modest in terms of how we name things. This is the Global Research, Education and Innovation in Assistive Technology Summit, which will be happening in Geneva later this year. And this is really looking to bring together a group of people involved in research in this area. And it's really important to point out that people involved in research are the users, they're the manufacturers, they're the regular researchers, they're also governments and so on. If we're looking at developing research infrastructures, it's not just about research expertise, it's about people who can actually make that happen in terms of its implementation. So the purpose of that overall meeting is to identify thematic research groups throughout the world, groups that will work together, often virtually, but sometimes have physical meetings as well. It's also to establish the need for further research funding, something we hear a lot of. This fantastic GATE initiative has been very generously funded by US aid. And while we certainly hope that their commitment will continue, this is an area that lots of funders should be interested in, not just donor agencies, but people who want to make very clear investments because they can see the potential of the return on those investments as well. Education and certification. It's already been referred to by a few people who spoke before me, but we need to do things in very different ways than we've been doing things previously. We cannot, as was said immediately before me, we can simply not reach the number of people who need the assistive products. So we need to find different ways of doing that, and we need to use what's used in some other areas, for instance, maternal health care, which is referred to as task shifting, where you identify what are the key skills that are needed, and then you train people in those specific sort of key skills. It took 8 years to train me to do what I used to do clinically, and now I know that we've had some programs where we're actually training people in 3 months to do things just as effectively as people who've been trained for that much longer period. Those things should not be threatening to us. They should be very exciting because they offer an opportunity to provide services and support to a much greater range of people. So we will also be looking at a really thorny issue, which is how to develop a common assessment methodology and approach where we could compare across different sorts of technologies about the extent to which they not only allow people to overcome impairments, but can promote inclusion and participation in society more broadly. And so from that, we'll be sharing some of the outcomes of that summit in the Journal Disability and Rehabilitation Assistive Technology. Some of the key components that are going to be required in terms of helping us achieve the Sustainable Development Goals. I think 8 of these Sustainable Development Goals explicitly mention the idea of social inclusion. The byline for all 17 of them is leave no one behind. This is a hugely open invitation to all of us in the assistive technology sector to look at how assistive technology can help achieve these goals. One level is looking at national assistive technology policies. In some countries you have things like assistive technology passports. In other countries you have a system whereby a Department of Education provides you an assistive technology, and then when you leave education you have to give it back, so that the technology belongs to the department, not to the user. a crazy sort of situation and a real sort of systems failure. We need to look at things like big data information gathering. There's some fascinating projects underway at the moment where the use of assistive technologies with GPS identification, for instance, are telling us where they're being used, in what sort of spaces. Are they social spaces? Are they work spaces? And so on. I've already mentioned the idea of comparative outcome measures. And then the idea of sustainability in terms of what we're doing. One of the, I think we're hearing in terms of Malawi, that there may be more prosthetists and orthotists trained, but people with international qualifications are mobile, and they may travel. So I think we need to again find sustainable solutions that make things much more close to the community level, and perhaps with fewer lengthy qualifications. Okay, so, whoops, that's a technology failure. So I'm just going to look at a few examples of what I'm talking about in terms of systems thinking here, and these are drawn from some work by Jessica Parr, Mary Scholl, and myself, and Jessica and Mary both had the privilege of working with the GATE team. But I just want to give you a sort of example here. So if you look at not systems thinking, you tend to look at product development being led by industry, and being led by industry because there's a niche and because there's an opportunity for a good return on investment. Both very appropriate incentives for industry, but not the best way to design a system for people. So you'd really want to look from a systems perspective much more at access to products, being multifaceted, including recognition of what's needed from the users, what's capable in terms of different production facilities, rather than having a few very strong advocacy agents that can strongly influence how a government invests its money. You would have a much more planned approach, again based along population data of what sort of impairments are found in the population, and what, from a national perspective, needs to be provided. I'm not going to go through all of these because I just want to give a flavour of each of them. I've already mentioned from the personnel point of view, I think the World Report on Disability identified 6 medical rehabilitation consultants in the whole of Africa. So any system that relies on a sort of rehabilitation consultant-led team is not going to work. It's going to fall very far short of our obligation to provide technologies to the people who need them. So again, we need a different way of doing things. We need to look at providing things at very much at a community level, and we need to think of different sorts and much shorter training for people. From a non-systems thinking perspective, assistive products can be provided at a sort of central hospital level, or from a systems thinking level, they can be provided much closer to where they're actually going to be used, and you can have secondary and tertiary referral mechanisms. A lot of these things, they are not brand new thinking. It's looking at what works elsewhere. If we like to think, how would we like to see assistive products being available to people, then it doesn't take a genius to work out that they can't be available just in the tertiary level systems, that they have to be available much more towards the ground. And then on policy, we've recently done a review on policy globally, and haven't really been able to find any single good national assistive technology policy. Policy tends to exist around assistive technologies as subsections of other policies, which is a real challenge, because when you look at the need for assistive technology in employment, in education, as well as in health and justice and so on, we really do need to push for at least providing guidelines for national assistive technology policies, which would then drop down into these different sectors.
You've had 18 minutes.
18 minutes, okay, and I was just about to finish. If you want to hear more about the Sustainable Development Goals and the role of assistive technologies, and I would recommend that you go to a paper by Emma Tebbett et al. This sets out what assistive technology can achieve for each of the 17 Sustainable Development Goals, including the goal that refers to life below water. So hopefully that will pique your curiosity. There are a number of other papers that refer to the role of assistive technology in achieving gain in one way or another. What we're really keen to do within GATE is to encourage you to go out and write papers and editorial pieces arguing for the role of assistive technology in your particular areas. As you can see, there's far too much to say, so I just say thank you, and thank you for your patience.